So first, cancer. Cancer is a disease in which a group of cells divides abnormally without any control. We know that cancer starts the journey from single cell. From single cell to millions of cells when they convert into cancer, and that fleshy growth described in Ayurveda is a arbuda, right? So cancer terminology in Ayurveda is as a arbuda. The cancer cell not only harm the local part but other part of the body tissues also, because that gives a rise to satellite lesions elsewhere and then eventually leading to death. So cancer is called a dreadful disease. Today we see that corona everywhere, just corona. Now we are tired. Am I right? We are tired from this corona. Before decades, the same situation was for the cancer. When someone just sitting right in front of us in our clinic, and when they just put the file in front on our table and just starts crying, and that was the havoc, that was the situation, that they cannot bear the diagnosis of cancer, that they have a cancer. So it's a dreadful disease because each and every person has a fear of death because of many reasons, like a late diagnosis, sometimes self-medication, right? Today we will talk about the practical oncology. So in our small introduction about cancer, we will discuss in between certain practical oncology, how to deal with patient, how to deal with cancer patient. So when just patient diagnosed with the cancer, right, first of what they will do, they just find some kind of the unauthentic, that in my term, why the cancer is so dreadful, that I try to make you understand why it's dreadful. Because first when they diagnose, they just visit some unauthentic clinics, which gives the guarantee that they will just control the disease, they will either cure the disease, and after that, when the cancer from the first stage enters into last stage, then patient came to our clinic or some visit to some surgeon or some allopathy treatment. This is a reality. So it's my request that first understand the cancer according to Ayurveda, according to modern science. So first what we discussed, that cancer is just only a cell, but that's uncontrolled growth of the cells, right? When that growth appear outside or inside the body, like in buccal mucosa, like in intestine, like in breast, like in uterus, anywhere, the fleshy growth, uncontrolled growth, they develop a tumor, a node, a granthi, that is called the cancer, right? So this is the main terminology of the cancer, and there are so many types like sarcoma, carcinoma, lymphoma, myeloma, leukemia, right? So most of the tumors, they are just like a glandular gland, like glandular growth, but in leukemia there is no growth, right? There is no tumor. That's a blood related cancer, right? So most of the cancers, they are the glandular, right? Granthi. What are the 7 danger signs of the cancer? Because I explained that when without any doubt there is a good number of diseases which develop and victimize mankind, but none can compare in importance to cancer because of the late diagnosis, and at that time in third and fourth stage, doctor cannot give a curative result. So it's called a dreadful disease. But in clinical oncology, when we just handle a primary tumor, which is just diagnosed with only first and second stage, at that time, cancer is curable. Right? So, don't miss the chance. Whenever you have a patient with a fleshy growth, a certain type of the signs and symptoms, right? Because a doctor must be skillful. Doctor must diagnose perfectly that is there any doubt of the cancer? Because see, signs and symptoms of the cancer are very common as that of the other diseases. Like a patient complaint that loss of appetite, a loss of weight, sometimes cough, cold, right, headache, sometimes bleeding from the nose, throat, urine, okay, stool, anywhere. So these are the very common signs and symptoms, right? So these signs and symptoms should be differentiated from the other common diseases, and then just touch the particular diagnosis. If you have some doubt about the cancer, you first have to thoroughly examine the patient. First take the detailed history, right? Detailed history regarding, like we just learned from the colleges, like which caste, which age, right? Which religion, what's the occupation, detail about the occupation, detail about the residence history also. See, all these things have a certain importance, because when we are just dealing the cancer patient, we must have certain kind of the knowledge. Later on we will see that some causative factors, they are related with the occupations. So we have to take the detailed history about the occupation. If they are just working in some industries, then which kind of the industries, since how long they are just working there, is there any exposure of the gases like ethane, methane or anything, right? Asbestos, right? So we know the long list of the causative factors of the carcinoma that I will not explain, right? Vinyl chloride, then boot and shoe industry. There are so many long list of the carcinogens, right? So we have to take the detailed history regarding residence. Why residence? Just only one person is there, so I cannot say, can explain. Yes, detailed history about the residence is for the certain causes of the presence of uranium in the soil. Because nowadays you heard one name called radon, R-A-D-O-N, radon. If a presence of radon is there in your residence area or in industrial area, this radon may lead to lung cancer. So in I think so in American country, right, they have a certain kind of the certification they have to take before buying any house or an industrial area. You have to take the certificate. You can just check your soil, your house soil, to lab and just claim whether there is a radon presence or not. If there is a radon, you can just buy back, right? So such kind of the causative factors, you must keep the knowledge. Then you just check them, and then if you feel some doubt, you can just advise the patient to test certain kind of the test for the cancer, because there are also so many kind of the test for the cancer. In an imaginary study like CT scan, MRI, bone scan, as per patient complaint. If the patient complain that I have a pain in bones, okay, then you can just suggest bone scan, right? But that just only one question you cannot suggest that you have to go for the bone scan, because in rheumatism also there is a bone pain. In so many other diseases there is also a bone pain, right? So first of all, you have to take the detailed history, and for that you must know the cancer in detail. What are the signs and symptoms? So we see that most common signs and symptoms according to Ayurveda was Arbuda explained in Ayurveda as a fleshy muscular growth, like it's a round shaped, firm, causing mild pain that may be large, that's deeply rooted in the body, and that's a slow growth in nature, showing no separation, and a swollen and fleshy growth. This is called a arbuda or tumor. Signs and symptoms, right? So these are the basic signs and symptoms of arbuda in Ayurveda. Now, as per the modern science, signs and symptoms, we know that loss of weight, loss of appetite, and bleeding, and many things I explained you previously, right? So just keep in mind before diagnosis or before just advise certain kind of the cancer test, right? First of all, you must know that if you have some doubt when the patient complains that I have some bowel habit changes, right, since 2 months, 3 months, like that period, and in that period when patient complains about the bleeding per annum, like bleeding with the stool, bleeding after stool, okay, so first of all take the history about the occupation, then dietary factor. You have to check all the factors. In diets, they are taking proper nutritious diet, proper intake of the liquid diets. So everything you just check it properly, and then go for the routine examination. Routine examination regarding systems. When the patient complains about the respiratory system complaints, then you just check all the parameters of the respiratory systems. So all the systems you have to check carefully, and then if you have some doubt, advise patient to take CT scan, MRI, right? So such kind of the test, imaginary test, that you can advise. Later, you have to just check the patient thoroughly with your palms, like you have to just palpate the nodes, whether there is palpable node in neck node, axillary nodes are there or not, okay, in a pelvic area if there is nodes, inguinal nodes are there or not, right? So after taking all the examination, just advise them certain kind of the blood samples. For each and every cancer there are so many tests. For the pancreas, some different tests. For the liver, some different tests. But according to Ayurveda, what we must know? We must know that if we have some doubt of the cancer, because we know that signs and symptoms clear, but if we find something over here, right, something over here, some nodes are there, right? So what we will do? We must have a knowledge about that node, how it described in Ayurveda. When you are just examining the patient, right, and patient have some ulceration in the tongue, and with the ulceration, patient have some palpable growth here, right, something like a growth like a line, okay. So how it explained in Ayurveda? That is Vd.Abhijeet and Vd.Abhijeet. Vd.Abhijeet means regional metastasis, when see a tongue, cancer of the tongue, when just spread to a local, very nearby lymph node, okay, that is called the regional metastasis or the Vd.Abhijeet. What is the Vd.Abhijeet? When you are just asking the patient that with this ulceration or some lesions, I feel some giddiness, I feel some vertigo, I feel some fainting, like the symptoms, okay, I feel some convulsions. So that means some spread of the disease may goes to the brain area. Clear? So that is the Vd.Abhijeet, means distant metastasis from tongue cancer spread or metastasized to brain. So this is called the distant metastasis or the Dvi-Arbuda. So simultaneously with the clinical knowledge, simultaneously just try to understand how these cancers are described in Ayurveda, how we have to take the history, how we have to deal the cancer patients, right? Next, there are so many types of the cancers. When the patient have some clinical history, right, of the diabetes, blood pressure, certain types of the hereditary diseases, right? So just ask when the female patient came to you with the doubts of the breast cancer. You just ask whether the breast cancer was present in your family, like your mother or sister had a breast cancer. So certain types of the hormonal tumors, right, hormonal tumors may present in next generation. It's not compulsory, and ratio is also not that much big, right? Maybe 20% or 30%, but still hormonal tumors may show a cancer history. So hormonal tumors are mainly two, and that's breast cancer and prostate cancer, right? If the father has a prostate cancer, the son must have to be careful or have to advise for the certain kind of the markers after the age of 40, right? For the prostate cancer, there are a PSA, right? So they have to check the PSA level in blood. That's a simple blood test, right? We have to advise the son, right? So when you are just doing a clinical oncology, okay, just read something about the cancer, common signs and symptoms, how it described in Ayurveda, how in modern science, because you have to keep it both the knowledge, right? Not only Ayurveda, you must have to update it yourself in a modern science too. Then and then you can just give a better result to the patient. See, cancer described in Ayurveda in many ways, but the information is not that much. Sometimes they says that text is missing, right? Certain types of the arbud like Osteoarbud only Bhavana explained. It means bone cancer, okay? Only Bhavana, no other acharyas explained, but no other details are found in our classical text. So in that cases, we have to just correlate, we have to just combine the knowledge without any justification, right? We have to just share the knowledge, we have to compile the knowledge, and then we can just practically absorb that knowledge on the patient too. We can do many kind of the research on them too, right? So such kind of the arbudas like Sonita arbud, Sharkar arbud, Mansa arbud, Karna arbud, okay, Navarbud, Jirnarbud. Navarbud and Jirnarbud means as per the chronicity the acharyas describe. So when we are just taking the examination or when we are just taking the history of the patient, we always ask that since how long you are suffering from this node, since how long you are suffering from this ulceration in the mouth, okay, any habits are there or not, because all the causative factors are not described in Ayurvedic tests as per the word. Like tobacco chewing is the major cause of the cancer, we know that. Smoking is a causative factor for many kind of the cancers. But in Ayurvedic texts, we cannot find that smoking is the causative factor of the arbuda. But we have to correlate certain kinds of the things that explained in Ayurvedic text that are correlate in modern science as it is, right? And including genetic factor, including viral factor, everything is described in Ayurvedic text. Okay, genes means our constitution. Our constitution is also responsible for many kind of the tumors, many kind of the cancers. So such we can just correlate that how the cancer or arbuda described in Ayurvedic text, and that is right and that is scientific. Okay, so slowly when you just start to read about the Arbuda, when you just start certain kind of the lectures on the cancers or in Arbuda, you can just slowly just come to get knowledge about what is Arbuda, how described in Ayurveda, and then you can choose the line of the treatment or the particular treatment for the cancer, right? So Navarbud and Jirnarbud means as per the chronicity, means Nava and Jirna. Jirna means that is to not that much early, right? That's a chronic tumor. And Navarbud means acute tumor. Then other varieties are the Sannipata Jarbud, Murmur Jarbud, head and neck cancer. Okay, head and neck cancer is also described in Ayurvedic texts. Each and every cancer, like nasal tumor, pharyngeal tumor, okay, laryngeal tumor, right, buccal mucosa tumor, everything they describe in Ayurvedic texts under the certain names, like Kapolarbud means buccal mucosa tumor, okay, Mukharbud means oral cavity cancer. In that you can just take the tongue cancer, base of tongue cancer, okay, so many things. Then lip cancer is also described in Ayurvedic texts, lip cancer, okay, under the name of the Ostarbud, right? And they just classified each and every types of the cancer, not in that much detail, but still it's very scientific. They just classified as per the size, shape, coloration, how the root is, okay. So you can just diagnose clinically when patient just sit in front of us and they have a lip cancer, okay, they have some growth over here, right? Thank you, Vairo Kulkarni ji, and thank you, welcome you all. Yes, when the patient have some fleshy growth over here on the lip, okay, so you just remember your classical or conceptual study, that how it described in Ayurveda, what is the size, shape, any examination notes are there or not. So when you just compile the clinical knowledge, then you will come to know first the diagnosis, whether this is cancer or granthi or simple shotha, because you have to do the differential diagnosis too. When there is some growth over lip or the buccal mucosa, it's not compulsory that is a cancer, that may be something else, right? So thoroughly with the classical conceptual study and modern science knowledge, right, you just come to diagnose the cancer. Then other varieties are explained in Ayurveda, like Galarbud, okay, Talwarbud, right? So these are the varieties of the cancer that described in Ayurvedic text. Now the incidence of the cancer, we know WHO every year they are increasing the numbers of the cancerous patient, and they just claim that till 25 more than 50% of the India will suffering from the cancer, right? So I think so we have to just forget the corona and we must concentrate on the cancer. Causative factors we just try to explain, because in last lecture I give you all the detail about the causative factors. So today only little, that some exposure to the sun, right, some ionizing radiations, that is also a causative factor of the cancer. Some lifestyle factors in Ayurveda, that fasting, some exertion, some rubbing, okay. Rubbing means what? Rubbing means when the person is just chewing the tobacco, what they are doing, just they are just mixing the tobacco, they put in the mouth, just keep it there for a long time, and that gives a local irritation, and that may a big causative factor for the cancer. So you understand how it described in Ayurveda. They are not just described like a tobacco or tobacco is the cancerous or it's a main causative factor of the cancer or the head and neck cancer, right? In allopathy science they describe clearly, that we know, but in Ayurveda they give the simple reason, that a chronic irritation, but chronic irritation in the form of the such kind of the causative factors. Some other factors are also there, like a walking for a long distance may cause certain kind of the tumor. Okay, some other factors in modern science like wood, furniture, textile industry, shoe production, okay, benzene, nickel production, asbestos, vinyl chloride, mustard gas, okay, alkaline agent, etc. may cause various types of the tumor. Some can cause the bladder cancer, some can cause the liver cancer, some can cause the lung cancer, right? Certain virus like herpes virus, helicobacter virus, papilloma virus, retrovirus, these all are the viral causative factors as per the modern science, right? Some Ayurvedic causative factors like some Vataj, Pitaj, Kaphaj, etc. Certain factors they describe, okay? So that all are the Ayurvedic factors, right? Some improper excision, right? Some post-therapeutic panchkarma, when you are just not taking care after the panchkarma, right? That may cause or leads to cancer. Ingestions of poisonous and polluted substance like a harmful leaves, flowers and fruit juice of Semicarpus anacardium may cause cancer. So now you just see the beauty of Ayurveda, that how chemical carcinogens can describe in Ayurveda, because on those days before 5000 years they just observed that when a person touches certain kind of the leaves, and after touching that leaves they may give some blisters, and that blisters olavrana, right, that never healed, and that leads to cancer or that may be cancerous. So such kind of the, yes, Ramdev Pandit, welcome, thank you so much, thank you. Okay, so certain kind of the leaves, they are also cancerous. Now crawling of urine, sweat and poisonous insects, right, on the body, bristles of poisonous insects, right, touching poisonous animals may lead to many kind of the tumors. So these are the common causative factors of Ayurveda. And today we will not go in detail about everything, causative factors and signs and symptoms and staging. Yeah, staging, because today I am just trying to talk about the clinical oncology. So simultaneously with the conceptual study and how to implement the knowledge clinically. Now we just turn to the staging, because causative factors there are lots of, even though in the Ayurveda, right? So when the patient came to us in clinic with some fleshy growth, okay, some muscular growth, right, outside you can see, when the patient complains that I have some ulceration on my buccal mucosa, you just say to open okay, you just thoroughly examine whether that is simple, only simple mukhapak as per the Ayurveda. Is that a mukhapak, okay, stomatitis, or that vran may because of the cancer? That you have to just differentiate. And for that, what we explain, you have to take the detailed history, right? Previously we just discussed that in detailed history you have to take care about each and every minor thing for the patient. And once you get the expertization, right, about taking histories and everything, you will definitely in 5 to 10 minutes came to conclusion whether this is cancer or not, right? So when patient just came to you in clinic, whatever the complaint they just shows, right, you have to examine thoroughly that system particularly, and for that you have to examine the local node and then distal examination for the metastasis. If you have the doubt of the cancer, then you can just take the detailed history and detailed examination of other systems, respiratory, okay, urinary system, right? Each and every system you have to examine fully. Now next, we were talking about the staging. Staging means we know that 4 stages: first, second, third and fourth. First stage means tumor is localized and less than 3 millimeter. Means it's not fixed for all tumor. Remember, means overall tumor must be a small size. Forget the criteria. A small size, very small size, right? And not metastasize to other part of the body. That is the first stage. Now what's the second stage? Second stage means a localized tumor less than 3 millimeter or 1 centimeter, okay, and may spread to a local region like a localized node. See, there are 200 types of the cancer. Each and every cancer has a different staging systems. This is for the general practitioner, how to give a staging, how to understand the staging, right? So when you just found a patient with a buccal mucosa and have a tiny node, lymph nodes over here, less than 1 centimeter. So this part of the cancer may diagnose as a second stage, right? For the rough idea. Third stage means when the tumor of any size but may metastasize to distal part of the body, like a CA buccal mucosa, a 2 centimeter tumor, okay, 2 centimeter, and metastasize to brain, metastasize to bone, right? That is a third stage. Metastasize to lung, metastasize to liver, anything, right? Fourth stage, any size of the tumor, any size, right? But more than maybe 5 centimeter and maybe less than 1 centimeter, but to distal part metastasize in the body. Means when a cancer of the breast metastasize to liver, that is fourth stage cancer, right? When the organ is involved, other organ is involved, major organ is involved, that is a fourth stage, and fourth stage is the last stage. Why the staging is important? Because stage is important to just know and plan the treatment. When we are planning for the treatment, as per the Ayurveda, as per the allopathy, we must know the staging of the cancer, right? And for that, I advise you to take a detailed history regarding staging. You just try to first go through one type of the cancer, because I explained that more than 200 types of the cancers are there. So you have to understand each and every cancer, right? Each and every cancer, signs and symptoms and staging, right? CA tongue, staging is different. Buccal mucosa, staging is different. CA brain, staging is different, right? CA breast, staging is different. So first of all, you have to just try to understand the staging. Then batterly you can just plan the treatment. You can just fix the very good and best line of the treatment of the cancer patient, right? You can, even though in Ayurveda we can give a best and better result, patient also will be very happy, and we also feel proud to give them a better result and best result, right? And before starting the treatment, I would request you all, please don't take any kind of the risk. If you cannot understand the cancer patient, if you cannot understand the cancer thoroughly, you just forward. Simply you just forward to the super specialist, okay? Because see, life is very important for each and every person. Either they are poor or they are rich. See, today we have a very great example of the Sanjay Dutt. We know Sanjay Dutt is in a very last stage of the cancer of the lung. How he is running here and there. He cannot visit to America for the better treatment. He has to take the treatment in the Bombay. So what? All the doctors give a great sympathy, great research, and that gave a great harmony to the patient. Either they are coming from any kind of the background. So, right? So this is oncology is the branch that gives you a best reward, and reward with the name of the blessing. So give a good harmony, a good love to the patient. You just treat them from your heart, not from your hands, right? You have to treat the patient from the heart, right? So how the Ayurveda gives the treatment protocol for the Arbuda or the cancer. Main 4 aspects. First, curative. In this part, certain kind of the herbs, now a very good research are there, right? Certain kinds of the herbs or plants, they are very good and gives a promising result in the cancer, like a Taxol, right? Taxol is just find out from the yew tree, right? Yew tree is found in the Himalaya, and that bark, right, they made a injection, that is a Taxol, and that gives the benefits in many kind of the tumors, right? So certain kind of the promising herbs and plants should be used. Second is the supportive treatment. In this, certain kind of the diet and certain kind of the plants should be used and modified to give a better result, along with the chemotherapy and radiotherapy. Just to combine the side effect of the radiotherapy and chemotherapy, there are so many herbs that minimize the side effect of the radiation and chemotherapy. So we should use that kind of the herbs and plants, and we should advise the certain kind of the diets too. Some prophylactic treatment means if some have the phobia or some have the exposure of the carcinogens, then they should adopt that diet, certain kind of the herbs, certain kinds of the kada in their diet, just to prevent themselves from the cancer. And not even when one person is diagnosed with the cancer, and after finishing all the treatment, when patient is NAD, after that patient should take certain kinds of the protocols, herbs, plants and kada, just prevent themselves to be a cancerous in future, right? So that's a prophylactic. And last but not least, and that's the palliative treatment, because today we see that in our clinic all we are just treating only a last stage cancer patients, because in very first starting of the lecture I just said why cancer is dreadful, because patient mostly visit to certain kind of the babas and sadhus and ammas and everything, and they just tried a lot and they just sent back a curable patient to incurable stage, and then they just say now visit your doctor. Now at that stage we are hopeless. We can't just provide, we can't just offer a cure. So in that stage only a palliative treatment is possible. In palliation, Ayurveda can give a best result, that we know. Patient can live a better quality of life with simple kind of the diet, certain herbs, some kind of the food, right? So all these criteria, all these treatment protocols, right? Curative, prophylactic, palliative, supportive, and we can plan the cancer treatment. So I think so it's time's up, and thank you so much. In maybe in future we will talk about certain research on the clinical oncology, how we can just take a good trial, right? How in our clinic we can just give a better and best control on the Arbuda and cancer, how we can differentiate certain kind of the tumors to a local some diseases, right? So till today I think so it's enough.